Gastroparesis is a very common, yet sometimes very clinically dangerous side effect of eating disorders and starvation. What are the symptoms of gastroparesis? When should you seek medical attention if you're experiencing something like gastroparesis? And how can you alleviate this symptom in your recovery journey from an eating disorder? My name's Sheena, and I'm a registered dietitian specializing in the care of persons with eating disorders. And this channel focuses all on the clinical and psychological components of eating disorders and recovery. So, if that's something that you're interested in, definitely click that subscribe button. The definition of gastroparesis is that it is delayed gastric emptying. Gastroparesis is actually much different than constipation, which is another side effect of eating disorders. So, we're really going to distinguish the differences in it today. Some of the symptoms of gastroparesis are getting full very quickly, difficulty passing stools, infrequent stools, or going several days without having a bowel movement, and your stools are often going to be small and hard. You may also notice bloating, nausea, and vomiting, stomach pain, and IBS, which is also known as irritable bowel syndrome. These are some of the more common symptoms of gastroparesis, which is often a symptom of eating disorders. However, when does gastroparesis become medically compromising? Severe gastroparesis, which is often experienced by someone who has undergone an eating disorder for a prolonged period of time or is experiencing extremely intense restriction or both, may include things like obstruction of the GI tract and pelvic floor dysfunction. If your symptoms of gastroparesis are very severe, definitely seek medical attention right away because some of these severe impacts of gastroparesis can be life threatening. A medical provider can help you with diagnosing gastroparesis through use of breath tests and upper GI endoscopy or an ultrasound. So let's dig into some of the reasons why gastroparesis happens if you're a person that is experiencing starvation and an eating disorder. So, first and foremost, our metabolism has slowed down to a halt and produced some of these symptoms of gastroparesis. Because we haven't been using the muscles of our GI tract, muscles have also atrophied, aka are no longer functioning in the way that they usually would be if we were consuming meals and snacks regularly. We also have a disruption in the gut brain axis and hormonal and enzymatic shifts that are intended to try to slow that digestion. When treating gastroparesis, it is very critical that you note that you cannot treat gastroparesis without treating the underlying eating disorder. The eating disorder will require an eating disorder meal plan tailored by a registered dietitian, as well as working with a treatment team, which often includes a mental health counselor and a PCP. Resuming regular meals and snacks with your eating disorder meal plan is the best way to ultimately correct that gastroparesis. That can help if you're experiencing gastroparesis in your eating disorder recovery are starting with some of your calories being liquid calories. Liquid calories don't require as much of the use of the GI muscles. Since these have been atrophied as a result of our eating disorder, this can be a slow progression into rebuilding those muscles. It also can be helpful to have smaller, more frequent meals because then the body doesn't need to work quite as hard and utilize as many of those enzymatic responses in order to digest the food. For some of those symptoms, such as extreme GI pain and bloating, nausea, you might also try things like having a hot compress on your belly. It's also really important that you practice normalizing your bathroom habits. So, what does this mean? This means that we are going to train our body again mentally and physically to have normal bowel movements. So it often involves practicing going to the bathroom at the same time each day and practicing having a bowel movement. Even if that bowel movement doesn't happen, the toilet at the same time each day can prepare your body mentally and physically for having that bowel movement when the time comes. Also try using tools such as having a squatty potty, which will elevate your legs in the optimal position for having a bowel movement. If you found this video helpful, please consider liking, subscribing, and sharing with a friend.